Mkubwa nataka nikuwe engineer.
Nikiwa mkubwa nataka nikuwe daktari.
When I grow up, I want to become a teacher.
When I grow up, I want to be a doctor. Nikiwa mkubwa nitakuwa mwalimu. Nikiwa mkubwa nitakuwa daktari.
Building from the previous 2022-2024 country strategic plan, Save the Children Kenya and Madagascar office is embarking on a transformative journey with its 2025-2027 country strategic plan aimed at improving the lives of children, especially those affected by conflict and climate change.
This country strategic plan refresh process really gives us the opportunities and space to take stock of what's going on in the world right now, as we also consult deeply and extensively with children, communities, local actors, partners, and all relevant stakeholders. We realize that climate change, inequalities, and gender injustice have become the root causes of the violation of children's rights in the world, and particularly in Kenya and Madagascar. And therefore, addressing these root causes is very important for us to achieve the ambitious goals that we set.
In keeping children at the center of this initiative, the Kenya and Madagascar office aligns with a global strategy and ambitious vision for 2030.
Every child deserves a better future. So as an organization, we have committed since 2016 to a 15 years ambition to enable children attain 3 main breakthroughs, and that includes survival. And what that means is that no child should die before their 5th birthday of a preventable causes. We have also committed that every child should learn from a quality basic education, and that is our learn breakthrough. Our third breakthrough is around be protected, and that every child should be protected against violence.
In the current strategic plan that is coming to an end this year, as we extending it to the next 3 years, and also having the future visioning of the future presence of our country programs, we take into consideration the voices of children. How can we work with and for them, with them being a forefront and leading these conversations and these strategies.
This country's strategic plan focuses on 5 key goals. First, it aims to ensure that all children survive and thrive, providing essential integrated health, nutrition, water sanitation, and hygiene services to all children.
We plan to make sure that we, first of all, focus on increasing and generating more demand for services. And this will include working at the community level, working with community health promoters, to work with families, to create awareness of services that are available within the nearby health facilities, and generate this demand. But the strategy uses the primary care networks, the community health promoters, and making sure that the community health strategy in Kenya works. We'll support standards and quality frameworks that will be there to ensure that when children go to facilities, they can access these services. We are targeting around 90% of children getting fully immunized with the required antigens.
Save the Children is committed to establishing functional child protection systems in Kenya and Madagascar, safeguarding children from violence and abuse.
If a child is traumatized or a woman is going through gender-based violence within a household, it's very difficult to tell unless they speak to you, unless you spend so much time with them. So some of the things that we did was, one, ensured that we strengthened the child protection technical working groups at the sub-county level, at the county level. We did develop a child protection and emergency manual and guideline that would provide step-to-steps on how to integrate child protection in humanitarian response.
The plan will strengthen child-centered resilient livelihoods and disaster risk management, equipping families to cope with the challenges posed by climate change.
We intend to prioritize more on the most vulnerable areas within the country that has been multiply impacted by shocks, and this could focus mainly on the ASAL areas. And therefore, by enabling those most vulnerable individuals or vulnerable households to address the demand side of, for example, education, health, and even food. So ideally, the impact is measured by the number of children that you've uplifted from poverty.
Save the Children will strive to provide access to safe, quality, and inclusive education for all children, ensuring they have the knowledge and skills to succeed.
We will ensure that we use context-specific, tested strategies that are able to enable children learn effectively and continue feeling safe in school. The first strategy is about building the capacity of communities and also schools to be able to support children to continually access education, irrespective of the situation they are in. We will develop the capacity of local partners, including the relevant ministries and the Ministry of Education, to be able to deliver safe, quality, inclusive education at the local level. We shall also build the capacity of teachers, including through continuous capacity development for teachers to ensure that they acquire relevant proficiencies to deliver quality teaching and learning at the classroom level. We will continue advocating and working with the relevant line ministries, including departments within the Ministry of Education and its semi-autonomous agencies, to ensure that refugee teachers can also access the ongoing teacher professional development program that is offered by the Teachers Service Commission.
We will advocate for strengthened and accountable governance systems and policies that prioritize children's rights.
This looks at to what extent are planning and implementation structures responsive to children's issues. And so across both Kenya and Madagascar, we shall be looking at those systems to make sure they are child sensitive. And we'll be, in this way, it's really about working together with government as a duty bearer, so that giving the right technical support, leveraging the synergies and the linkages to really make sure there's that understanding of what it requires for systems to be responsive to children. We'll also look at the area around policy, and much as there's quite robust policy formulation across the sectors, not just for children, is that ensuring there's a child lens to them and that they respond to the realities of children, they're addressing the needs of children, they're leading to positive outcomes for children. The other area would be child rights monitoring. So as I've mentioned, the fact that there are commitments made, but we want to check how accountable government as a duty bearer is to those, and to what extent they are really taking the mandates, state mandates, in terms of having the right policy, legislative frameworks, institutional and the right practices. How responsive are they to them?
To drive impact, we will leverage our strong partnerships with communities and local actors to enhance the use of evidence through research and learning, and ensure that children's voices shape the programs and policies that affect them.
We did have an engagement session with children in all our operational areas. One of the major issues that kept coming up from most of the areas we consulted children was around child marriage. It's become a concern. Children have to drop out of school, and when they get married, there are issues around not being able to make decisions because of their position. And so this, leads to so many other challenges, such as health challenges on them and all that, because they can't make reproductive health decisions. The second biggest one was around drug and substance abuse. And this was both in the rural areas as well as urban informal settlements. So what we've done is to incorporate their ideas, their opinions into our strategy.
Finally, we will invest in digital solutions to enhance program quality and sustainability.
We are living in a digital world, and Kenya is quite advanced in terms of technology, and Madagascar is not left behind either. So we will leverage on digital technology to really accelerate the impact for children. We need to resource this strategy. So making the right choices in terms of diversified funding opportunities, working with various donors, both institutional and non-institutional, and being accountable to every coin that we receive from our supporters will be critical. We cannot do it alone. We need the right partnerships. We need to collaborate more with all the like-minded stakeholders, and with that, then we will be able to, holistically address the needs of children.
Our success as Save the Children in the movement and also in our Kenya and Madagascar team, it's about creating long and sustainable impact to children's lives. We believe that every child deserves an equal chance to be successful and to grow at their fullest potential. And that will be the success that we look for in our Kenya and Madagascar country office.